Well, welcome everyone. My name is Ernie Wiggins and I'm the chair of the Junior Member Task Force for the APDR. I'm glad everyone could join us today. This activity is something that we had brainstormed in the past in our committee, and we really wanted to give an opportunity for us to discuss some issues that may be of concern for junior members, new members of the APDR, and new program directors. And we wanted to have a mix of both junior members and new program directors, as well as more senior program directors, which we were able to get today, which I'm really excited about. I just want to let you know that the session is being recorded and will be posted to YouTube, so you'll be able to watch it again at your leisure. I'm just going to introduce our two panelists who will be running the discussion today. We have Angelisa Paladin, who's the Vice Chair of Education at the University of Washington. And we also have Ann Jay, who's the Vice Chair of Education and Program Director for Radiology Residency at MedStar Georgetown University Hospital. So thank you everyone for joining us today. I'm going to turn this over to Dr. Angelisa Paladin to begin our first discussion on the Program Director calendar.
Great. So welcome everyone. First, I just wanted to kind of go over a little rule set. So there's 9 of you, which is great. So we have a nice small group. So we can probably make this more interactive than when we've had larger numbers. So I really welcome you to ask questions, and you can do that. If you look down on your panel, there's a Q&A button that you can write your questions in and let us know. And then where's the hand, Ernie? I'm just looking at that now. How can they raise their hand? I don't see it.
See it either. Oh, if you click on your name under participants, you should be able to, under more, it should say, oh, I just saw it.
It is visible to the attendees. They have a different window they can see.
Yeah, so.
Oh, good. Okay. Yeah. So what I ask is that Ernie will be, as I speak, he will be watching to see if anybody raises their hands, and then he'll just unmute you and you can ask your question. And we would really appreciate your thoughts. And Monica just wrote, yes, next to my Q&A button. So perfect. We're ready to go.
Thank you. Perfect.
Okay.
Thanks.
So I first want to just acknowledge where this concept comes from. I was a program director for 12 years. And my first year I went to AUR and I saw a lecture by Daryl Heitkamp at AUR, and it was regarding this topic, and it was calendaring. And when I first became a program director, I was very overwhelmed with the amount of tasks that I had. And so I just really appreciated his thought process on how to break things down and start to delegate. So first, I'm just going to share with you how I start it every year. So I'm going to bring up can you see that, Ernie?
Not yet.
I have to share. Okay, just a second. I have to get back to my thing and then say share screen. Okay, here we go.
Yes, we can see your screen now.
See it. Okay, so what I recommend you doing is sitting down at some point every year and categorizing all of your activities that you do every year. And so I just did this. Now that I'm Vice Chair of Education, I'm sharing this with all of my residency and fellowship directors. So I did this with my administrator. And so we broke it down into large tasks. And so you can see as a program director, we are responsible for our trainee compliance with all the ACGME requirements. As you can see, for program accreditation, I wrote down milestones, our CCC, our PEC, our annual program update, our surveys. We're in charge of all of our curriculum, our scheduling. We oversee our administrative duties, which our administrator does, but we want to be partnering with them on all of the duty hours and attendance and the budget. And we have moonlighting. Recruitment has its own bucket, as you can imagine. It's a huge part of what we do. And so these are the large ticket items that we are responsible for: research and then events. We have graduation and research day each year. So that's how I start, and each program will have a different variation of this. So I recommend you start with a bucket list and divide it into categories, and then you add on to it each year. And what I mean by adding on is, as you know, the ACGME requirements start, they have new ones almost every year. And so then you would add that, those new requirements into your bucket, and then you would calendar that appropriately. Okay. So for instance, like we had to start under curriculum having business of radiology and informatics. So that was a new addition from the new ACGME requirements. Okay, so then after you then put everything in buckets, or this is just my approach and you can do it in any way you want. What I do next is I take one of these items and we write an SOP. And an SOP is what's called a standard operating procedure. And it basically takes a activity and breaks it down into all its parts. And so I'm going to show you what that looks like. The benefits of this detailed organization list is that, as Anne was just sharing with us before you got on, is that she recently had she has a new program administrator. So if you write up all your activities, then when one of you leaves, if, for instance, when I stepped down as program director, I was able to give the new program director all of the SOPs that we have had over the years, so that she's not as overwhelmed. And we try to update these yearly. So here's an example of what was on my chart, is that each year we do an R2 pre-call exam to make sure that our R2s are prepared. And so we basically write what the content is, what the procedure is. So here, for instance, in early March, we have to send an email. Then in March, we have the R3s start gathering the cases. And as you can see, in early May, we then reserve the room. 2 weeks prior, we get the food. So I basically have put every little step of that single activity. And then what you do is you calendar it. So you put the date of the exam. Obviously, I think ours is usually in May. And then you put in early March on your calendar, notify, please, or send email regarding the exam. And then you pick a date in March, like I said here, recruit R3s to prepare the exam. So by breaking down each activity and then calendaring it, it allows you to sleep at night. For quite honestly, my first year, I felt like I was going to sleep or going to bed and not being able to sleep well because of the amount of details in my head and the fear of forgetting and letting something slip through. And so I found that this, so then I went and talked to my chair, and he shared with me the concept of an SOP. And this has been a lifesaver. And that's why I wanted to share it with you. It's a very basic principle, but as a new leader, it was not something I was ever exposed to in my medical training. So it's basically a checklist, which I've become the queen of, is checklists. And so the other thing that I wanted to share with you, why I feel this is so powerful, is another mistake that young program directors make is taking on all the responsibility rather than delegating. So what this allows you to do is to see all the tasks that are needed for an activity, and you can delegate. You can put a name next to each one, and it allows you to then monitor their progress and still be leading it, but be giving another leadership opportunity to someone. So as you can see, this is what I've done. So for the R3s for this activity, I had them write the questions, them prepare the exam, and then they meet with us. So that is what I wanted to share with you. Does anybody have any questions or thoughts or variations on what they do?
There was only one question so far about just sharing the slides at the end. I know that this is gonna be recorded. I guess if there's anything that you feel would be worthwhile sharing, Angelisa, we could always, potentially put that on the website, whatever you feel comfortable.
Oh yeah, I mean, absolutely. I think each program is different. I'd be happy to share this standard slide of just where all the buckets, that seems to me shareable. The R2 practical, probably not, because it's really specific to my program, but I can put it up as an example. But anyway, so that's basically, it's time intensive. So again, I didn't write all the SOPs. I actually divided them between my entire team, and my administrator wrote some, the residents wrote some, and then my associate program directors, whatever they were in charge of, they wrote it. And then when we have a changeover, all those documents are stored on a central server and then given. And it's been a great, because in my tenure, I had 3 different program administrators, and it was very stressful. But once we started creating these, then it became a lot easier. So I just wanted to give you that practical tip. And I have found it to be one of the most powerful things that I learned as a new program director. And so I wanted to share that with you.
Great,
okay.
Thank you. Thanks. I'm looking for Anne. It looks like she dropped off of my host list. Amanda is trying to track her down right now.
Oh, okay.
But one of the other things that we were going to discuss was just ACGME paperwork. Oh, Anne just popped back up. All right, hold on. Let me see if I can. Anne, are you there?
I am here. Can you guys hear me?
Oh, great. Yeah. Yes, thanks.
Oh,
nice save.
Look,
video
right on time. Even. Oh my God, I am so sorry. We're building a new hospital. And so I'm assuming that the construction people very nicely cut the power on accident. So I am really sorry, everybody. And I'm sorry to have missed your talk, Angelisa. I thought you were going to put my life in order.
Yeah.
Great organization ideas. Okay, so can I share my screen now?
Yeah, go for it. Thank you.
Okay.
Perfect timing, actually.
Is it? I tried.
Yeah, you right back in, right? We're ready for you. Perfect. Thanks.
Perfect. Okay. So hi, everybody. So as you all know, especially right now with the times that we are in, with the racism pandemic, it's really important. And I know that a lot of our institutions have been talking about diversity. It is an ACGME requirement that we teach our residents and have a curriculum about diversity within the program, which was implemented in July of 2020. So it's important to think about recruiting for diversity. And so the problem is that especially in radiology, I was looking at sort of my numbers last year, and I realized that there's a pipeline problem, right? And so it would be easy for us in radiology say, well, we don't have a lot of women, we don't have a lot of underrepresented minorities even sort of coming into radiology, so it's not my fault. And I think we need to think about it in a different way. The slides that I'm going to present here are from the AAMC. So the URL was way too long to put on the slide. So if you just look up holistic or Google holistic review by the AAMC, they have a whole section about, administrators or program directors and different presentations that are geared to different roles. So disclosure, I have not actually used this method, but I will be using it this recruitment season and starting from today, as you know, because ERIS opened up today. So the definition of a holistic review is kind of looking at the entire, it's just what it means, right? It's looking at the applicant as a whole, not just numbers. And I think that's something that all of us really have difficulty getting away from, is just looking at the numbers, especially since there have been recent papers saying that, you know, if someone has a USMLE score below 220, the rate of failing the boards is much higher. So we think about all this stuff, and we're in a field where excellence is sort of praised and looked at, but we also need to look at the individual as a whole, because while they all might be arriving and applying to our programs, and they're here at our front doorstep, the way that they got here may have been significantly different. So I think that's really important. So what the holistic selection process is not making up for previous injustices. It's not a quota system to say like you need a certain number of underrepresented minorities in medicine. It's not to lower standards, but it's to expand them and look at the sorry, go away. Okay, and then, but it does not ignore academic metrics. It's supplemental to that. So these, I'm not going to go really all through this. These are the core principles that the AAMC put out as their holistic review. It's just having to believe that it is that knowing that having diversity in experiences and diversity in the people that are in your program really expands the experience and the richness of the education of all of your residents. So to me, this is a very powerful slide. And I think it really sort of talks about why we do a holistic review. It's not about equality. It's not saying, well, you guys all got the same MCAT score, you guys got all the same step exam, or the same step 2 exam. It's about equity, right? So if someone has to work the entire time they're in college, or maybe even have to work during medical school because they have a parent who is sick, that same test is going to be arrived at and taken in a much different way, right? Versus like if you have someone and your parents are able to afford like a really good review course, versus someone who has to check out books from the library and have to study by themselves and have to work at the same time. It's very different. So where to start with this? So using the AAMC guide, they want you to think about what is most important to your program that a future resident have, like in terms of the qualities. So they broke it down into 4 different rings: experiences, attributes, competencies, and metrics. So how do we use this? So experiences means encompassing the path an applicant has taken to get to where he or she is. So this is sort of a chart that they put down, and this is just an example of stuff that you can that they provided, and you can certainly fill out other things like, you know, did they have to work while they were in medical school or in college, and how important these criteria are to you when you're looking at an applicant. The next one is attributes, which includes the applicant's current skills, abilities, personal qualities, and relevant demographic factors. So, you know, you can look at all of this and again, decide for your program, which one you think are the most important. Like for me, like grit is something that always comes up and something that's very important to me. I want to know that no matter if it's, you know, having to come up in a very poor background, or even if you had a very privileged background, but you had a difficult situation, that you're able to face adversity, face failure, be able to stand back again and have resilience. And I want to see some of that in an applicant. The next one is competencies, which include the way an applicant applies their skills, including how they think, achieve results, interact with people, and self-manage. So these are pretty much the competencies that are in our milestones that you guys are all aware of, and you can choose. I'm not going to go through all of these, but you can sort of choose and pick again which ones are going to be most important to your program. And the last one are the metrics, which includes the quantitative, scholarly, academic components of an applicant's portfolio. So for me, I think what we're going to do this year is kind of give points Give points if the candidates are women, give points if they're underrepresented minorities in medication, in medicine, etc. So those are the things that we're going to do in order to then invite them to interview. Then you take your criteria and then you take the ones that you want to really sort of look at and the most important for your program. And you this is a form that they provided, life experiences out of school. And then how are you going to assess that? And most of this information will be in ARIS. And so it's a much more deeper dive and more careful combing of the applications, which can take a little bit of time. So some insights, I think, I feel like studying, if you're a medical student and studying is your only responsibility in life, that's really a privilege. So if that's all you're doing for med school for 4 years, you better have done it pretty darn well. Opportunity cost taken away from studying, from service, like from doing service work, high level athletic endeavors, or needing to pay, or needing to work to pay for school, I think is very important. If you're a first generation medical student in any way, that's a really important milestone for that family and also a really important consideration. If you're underrepresented minority, just understand that that road taken can have been very much more difficult than for others who are not in that community. But, at the same time, if people are born into privilege and don't have a difficult life, it's not really their fault. But I also think that if they choose not to expand their scope of empathy by understanding the lives of others, I think that is their choice. And it's not about just recruiting a diverse residency and saying yes and checking off the box. But once the residents arrive into your residency, how are you going to make your residency equitable? How are you going to bring them up to the level of your other residents? Remember, it's not being equal, it's being equitable. So any questions on that part?
So Anne, can you hear me?
Yes.
So we spent a huge effort bringing in women and underrepresented minorities. I want to warn you, I felt really proud that we had made that an effort on our recruitment. And then when they arrived, what I didn't appreciate is that their experience might be different than our typical past residents, and they struggled. So if you can imagine, it's not statistically possible, right? If you think about it, but 3 of our 4 underrepresented minorities failed their boards. Mm-hmm. And they were AOA. They were very successful, very capable. Their AOA, amazing USMLE step 1 scores. So it shared with us that it wasn't inherent in them, but it was something that the program wasn't in tune to while they were here. So I just want to warn that the first step is making it a priority of the program, which I think we did well. But what surprised me and what I didn't do well, which I could have done better, is making the experience when they were here more supportive. They didn't let us know until it was a little bit too late, but now we have a huge push to start new initiatives and better mentoring. But what I learned from that, they've given lectures, and we had 3 of our Black residents talk about, and it's very timely, is that they're very distrustful of authority. And so they didn't feel comfortable coming forward. So I just want to put that out there just to think about it, because I think the first step is recruitment, and but then the next step is making sure, like you said, that the program provides equity, but I would do a little bit more check-in. And the women Absolutely. Too, I think some of the women struggled as well. So
I think
that's the next step.
Can I just ask, I mean, what did your program identify, or what areas did you identify that you could address some of the issues that were brought up by the residents? Like, are there things that you've changed?
Yes.
You've
so
added?
we had them go through and tell us what was wrong. So some of the universities they came from were not well known. So for instance, it's a natural question, but a lot of attendings will say, oh, where did you go to school? And they would say something like Hahnemann, or a school that maybe is not as well known on the West Coast. And they felt less than. Then if this happens too, but it's so true, but names, people not knowing our residents' names. And if you have 3 women or 3 Black or 3 Asian, that you get them mixed up, but you call them of this. So one gentleman would be called David, even though the other person was named David. So just the actual identity of the resident, and then calling them the wrong name. So little subtleties, but it was felt.
Right. So those are like the microaggressions, right? And people want to, people want to be seen, right? And I think there is such a strong imposter syndrome within medicine.
And that's what they talked about. That's exactly, the women talked about it and the Black residents. So so we are starting a symposium on microaggression. Our chair started it was very eye-opening. I cried, Ernie. I was so distraught because it's so painful to hear that people that you thought, you were so proud of them being there, but that they weren't thriving. And then we just had a lecture by one of the graduates, Tina. She's gone on to work private practice in Florida, and she's giving a lecture every year. She talked about how she didn't feel supported, and she asked for Juneteenth off, which is a celebration of, as many of you know, and she wasn't given it. Just little things that were important, but that she also admits she didn't speak up.
No, I think it's
those are just some of the, Ernie, that's just some of the, and maybe you can speak to if you have experiences, or if anybody in your program has also highlighted experience. But
yeah, I mean, for us, we're a smaller program, so I think that in a lot of ways it makes it a little bit easier for us to have that one-on-one connection with the residents, because we spend so much time with them, and they get to know us even more on a personal level than maybe at a larger program. And having that relationship with our residents has really helped us, because if a resident had any concerns about the work environment, or how they're being addressed or treated for whatever reason, it's a lot easier for them to come to us, and I think we can catch those things a little bit earlier. And that's just one of the advantages of being in a smaller program. One of the things I wanted to do is kind of open it up to the participants. If you just raise your hand on the app there, I can unmute you, just to see, what are your residents experiencing? Are there any barriers that they've brought up, or issues that they brought up, and how have you addressed them? So if there's anybody who'd like to share in this discussion, that'd be great.
Just a couple of things while people are thinking about maybe their question. I kind of think of it as this, like, I went to public school, right? But my public school has taught me how to take standardized tests for my entire life. And then my parents also pushed me, my public schools pushed me to do well, right? And they gave me all the resources that I needed to do that. Versus if you have someone else who is, for, lower socioeconomic or different sort of upbringing, they may not have had that. And so by the time we start college, even though we made it to the same college or whatever, that they're years behind of all of this sort of training along the way, year after year, of how to take standardized testing, how to take, like, I am not, for all the men in my family have been physicians for generations, but I'm one of the first, my older brother and I are the first generation American trained and studying here. And even though I was born and raised here, things like, asking attendings about how to do research, even though I knew I had to do that, stuff like that doesn't come easily for me, because in my culture, it's just awkward, and I just didn't know how to do that. So these are just things that you might want to think about, right? Or just understand that things are a little bit harder for people to ask for help, especially if you have imposter syndrome. Then if you ask for help, then it's like, well, then everyone's going to know that I really am this dumb or incapable or whatever. So just things to be aware about.
Yeah, and for all the new program directors, if this is one of your first or second cycles going through the interview process, I would warn you that and this isn't always true, but I have found that some of our strongest residents do not come from the named schools.
Absolutely.
So I think there's a lot of people that say, oh, if you had everybody from, let's just say Harvard, Stanford, and Duke, I don't know, that your class will be really strong. My anecdotal experience, or it's subjective, not truly objective, found that was not the case. And I don't know why. I have some theories, but so I think I really appreciated her presentation. We found that looking at a holistic and finding that grit and finding those applicants with leadership and different types of experiences have been fantastic residents. So I would definitely recommend you not using the name game and really diving deeper into the applications.
That's a really good point. And unfortunately for our specialty, it's very difficult to tease out who is going to really thrive in radiology from a brief interview day. There's a component of it that you just kind of have to be able to make a finding. And that's the very basic thing that we can't test for in the interview day. We don't know when people start. In addition to the medical knowledge and applying yourself and just trying. So that's a really good point. In the interview day, it's very difficult to kind of tease out. And if you just kind of get focused, laser beam on what school and what credentials and who wrote the letter, you may be missing out on a really good candidate and maybe even a better radiologist in the future. Someone did post a question here.
Yeah.
Let's see.
It's a good question.
It's a really good question.
Oh, you can see this?
Yeah.
I wonder
Nicole,
if everybody.
We have a lot of women in our program. And there are some faculty. So what I have shared when I was program director, I told them it's their right to take time off from the residency and they don't need to say why. So I think women so it's really interesting. Men, when they need to take a day off, they would call me and say, I have to take a day off. It never said why. Women, again, this is a general, but this is mostly true, would share with me every reason as to why they had to take the day off, and it often involved childcare. So I just told them to stop. It's their right, and no one needs to know why. And so that worked. I think that really helped them understand it. And then the faculty didn't ask anymore. So yeah. I think also, when women would share that they had to go and take their son to the doctor's appointment, there would be some people that did not support it. So, but if they said, I have permission to leave, I need to leave at 3, then it went just fine. So that's kind of how I handled it.
We also have flex days for our residents who don't want to take off time or if they have to travel. And DC traffic can be pretty horrible for the doctor's appointments and stuff. We give them 5 flex days where they can use to go on appointments, no questions asked, that you can just go and take those days off. There was an issue. There was a time when there was quite a few women who were pumping during the day. And as you know, you pump it's such a pain, and you have to go and you have to pump and time it between conference and reading out and doing all this stuff. And so I made it, I would be just go. You don't even have to say anything. I know where you are. You're not going to be going and hanging out in the cafeteria. I know that you're pumping. And if you have any issues with any section, you just let me know and you just shut it down. Try to get, and if you don't feel like you are empowered to do that, please ask more senior leadership, have them send out things saying, this is the law. You can't make them feel bad. If you are going to support women being here, you can't be microaggressive and say, you have to go pump again. Like things like that are just unnecessary and unnecessary stress to the residents. And it's really not showing that you are being supportive. So that kind of behavior really should be just shut down. If people are feeling like it's consistently having to take off, consistently having to leave at 5 instead of the normal work hour of 6, that's a conversation you're going to have to pull in with the resident, because work is also work. But life happens, right? And they should be able to take care of their child. That's like the biggest stress in life, is having that inflexibility.
I think you kind of touched on something I think would be worthwhile to discuss. How do you deal with a faculty member that hasn't bought into the idea of whether it's a diverse and equitable workforce, or providing time for female residents to pump or do whatever that is required, or any residents really? How do you deal with a faculty member that hasn't bought into the idea of having an equitable team and work environment?
Well, we have a relatively medium to small size program, and most of I would say 65% of our faculty are women who all have been in the same situation. So we didn't have that much of a problem. Angelisa, did you?
I'm thinking about it. It's been a slow progression, Ernie. I think about 10 years ago, there was a difference. The attendings were older. They didn't understand, or they didn't acknowledge the differences in the makeup of the residency. And we did struggle with it. I'm not gonna, it really, to be honest, it didn't really help to speak to them. It wasn't something, the culture change came by hiring our own residents. And over time, that culture changed with our new, we didn't have anybody egregious, but
Okay.
There definitely were people that made it known that they weren't as supportive as they could be.
Right. And that's the thing. It's like no one is, I feel like being egregiously bigoted or unsupportive, and that's just not something that is allowed, and really sort of probably illegal in the work environment. It's just all of these microaggressions. And I don't know, I feel like very fortunate that MedStar has come completely behind all of this. We have dedicated lactation rooms specifically for residents and physicians in every single one of our 10 hospitals. And it's really like a global push, like this is how things are going. And, I think my chair was also very supportive of all of those initiatives as well. And if there was going to be a shutdown, it would have been from him or one of our female senior leadership.
Okay. Any other attendees, if you want to raise your hand, if you have any comments about, how, if you've encountered this with anyone who hasn't bought in and how you address that, or any particular issues that you feel might be worthwhile for the group to discuss. Raise your hand, or if you want to type it, we can all see the QA typing. Getting back a little bit to the interview process, as people are thinking, if we can always circle back.
We should ask if anybody has anything that they're dealing with now as a new program director they'd like us to address.
Right.
I also have, just in case, Angelisa and also Ernie, I brought these things up really quickly if there are no questions, but.
I did have a question, just in terms of, as Eris is open today, as we're going through the interview process. And I think you've touched on it a little bit, but kind of what, and again, I want to open this up to others too, but like kind of what attributes are you really looking for in a candidate? Like if you say, all right, this is somebody that we absolutely have to have.
So,
go ahead.
No, I think Anne touched on it. We look kind of for that grit. So we look for criteria that shows that they are a good citizen. So volunteerism, leadership, interesting family background, just how they apply themselves. I have found that history majors and English majors are outstanding writers. We've had, when I did not a paper, but a search of all of our graduates, our PhDs that we recruited, 85% of them went into private practice. And it was flip for the history and English majors. 85% of them went into academics. So
Sure.
I actually look for history. We like to have people stay in academics because we're an academic center. So I actually look for non-traditional majors for their, and that is, I thought that was a really interesting, because they like to write.
Right.
Those are just little things, but we also have their core honors. So we like for them to have 3 core honors in their 6 third-year grades.
Mm-hmm.
But we'll see.
Yeah. I mean, aside from grit, I also look for integrity. And so, I look at the ones, like if you look at their honor on their dean's letter, and, I don't even necessarily bother with the honors one as carefully. I scan those. What I do look very carefully at are the ones that are passes or high passes. And don't forget, like, the grade inflation is crazy. So an honors doesn't mean anything a lot of times, because then like 75% of the class got honors in surgery. So a lot of times the grade doesn't mean anything. So you really want to go through your dean's letter. And I would say, look at the ones that are pass, because that's when they thought that no one else was looking and they thought wasn't in it, like a, throwaway rotation or wwhatever. And you'll see there'll be some very good tidbits of information in there. Mark asks a good question.
Thank you. Yes. Yeah, Mark asked a question about any inequities in the online interview process.
So,
yeah, go ahead, Anne.
So yes, there has been a paper written about this, and it's sort of like, I know that you guys are probably looking at me and trying to figure out what the heck is in my background and like whose pictures are those. And I'm looking at Angelisa's like chandelier and how pretty it is. And you're just trying to, like when you're there, you're not really focusing on the person, because there's not the in live person experiencing. You're talking to the person, but you're also like looking at everything else, right? So one thing that we have being mindful of these biases. One is just addressing them, and knowing that biases come up is really important. I have my recruitment team go through bias training with the Dean of Diversity and Inclusion every year before the kickoff of the season. Yeah, so if you guys don't have that, I'd be happy to give a presentation. I've been doing a lot of it as well, and just something that you like. I always tell in the recruitment committee, like, before you go in, just be mindful that that certain biases come up, and just keep them in check. There's even little things like there's a rainy day bias, and people who interview on rainy days actually get marked lower than people who interview on sunny days. And it's just things that you're not aware about, because there are all of these unconscious biases, but just being aware, I think, is really important.
Yeah, some of the things that might address is you can have, I think our program director is going to have a standard background so that everyone's background is going to be the same to get to your point. And different environments might be distracting and could lead to bias. So one of the simple things you could do is send everyone a blank background and ask them to have this as their background. As faculty, we will all have the same background. I'm hoping, on a positive note, Mark, I'm hoping the fact that they don't have to fly and the lack of expense, that we will actually have a more equitable process, because I think financially some people stopped interviewing because of cost. So the fact that we don't have that cost, I think will be really helpful. And I'm actually quite excited about that. I do believe that your interview team should do the unconscious bias workshop, because it is, there's modules and there's a lot of information out there. So I think that's really healthy. Those are the ones that I can think of. You know, I think it's hard not to judge if someone is on an interview and their family member or their dog, you know, will you mark them lower because you think they're not taking it seriously? I think what's going to happen is those experiences will come up when you have your discussion about the candidates with the rest of the panelists, and it would be good to share, like, this is what I experienced. What do you guys think?
Yeah, and some of the, we've been doing the Zoom interviews with the medical school, and some of the things that have come up in the committee discussions have been, well, the person hasn't been very, they're not very gregarious. And so there's things that don't translate when you're doing Zoom. So just something to be, you know, just something to be aware about, and really sort of try to judge on the content of the conversation rather than whether you think the person is too reserved. And that's the same, but at the same time, you know, communication is such a big part of our profession that you have to be able to get that sense of the patient, the person will be able to communicate as well. It's hard.
Any other program directors want to raise their hand and share some of their insight?
You can call on them, can't you, Ernie, if they raise their hand? Can you unmute them?
I see Mark Mullins on. Mark, do you want to share?
Yeah, they're talking permitted.
Can you hear me?
Yes.
Yeah, this is great. Thanks a lot. I've really enjoyed it. I tried not to be insulted since I went to Harvard Medical School. I tried to put that aside.
Mark, I saw you.
So,
I know. You're an exception.
Thank you. You know, that's funny. Yeah, I think it's interesting. I will say that under the question earlier, what do you do when you have a faculty member that isn't really with the program? And I agree that, you know, these things are changing over time and it's less of an issue now. And I will say that one of the things that came up early on when we tried to put in things like wellness days was that the faculty weren't getting them. And then people would use that and say, hey, you know, we're not getting that, but the residents are. Or, you know, we started a track in, you know, some area and they say, wow, I'd really like to be able to do that, you know, like these kind of passive aggressive sort of like comments every now and then. It's much more accepted now. Now it's kind of like not an issue, and we've kind of worked to get needed days off for faculty as well, although still we don't have it as supportive as it is for the residents and fellows. I think the thing is, the talking point is that being a resident and a fellow is not the same as being an attending. The attending, you know, that's your main job, and you're the captain of the ship. You're supposed to do these things, and they're expected of you. The resident or fellow, on the other hand, is expected to do a lot of reading and studying and to do all sorts of other things. And in all the facilities we go to, a lot of the call, right? So it's not the same. And then sometimes people will hold on to, well, when I did it, it was this way, and when I did it was that way. I don't hear that much anymore. So I will say that when we first started this 10, 15 years ago, that I heard more of it, although not a lot, like what you guys were saying, not a lot. Individuals, and honestly, individuals that seemed unhappy in other ways as well. And then also, you know, I don't hear it much anymore. And I think, you know, you just sort of move in kind of that direction. I have always tried to use people's real names, and I've always hoped to pronounce them correctly. One of the most heartbreaking things I ever had happened to me was on the last day of a resident's residency, he told me I had been pronouncing his name wrong for 4 years. And like that was the last day. And, you know, thank goodness he mentioned it to me. So I say it correctly now, but at least, you know, I want to, you know, I want those things. And I try. It's a form of respect. I think you guys really hit the nail on the head with that. It's a form of respect and connecting with people and all those kind of things as well. So this is great discussion, and I really appreciate it.
Great. Thanks, Mark.
I also see Dr. Nolan Kagetsu online.
Yeah.
Nolan, would you have any words of wisdom?
Let me unmute him. Nolan, you should be unmuted there.
Great, thank you so much. You know, yeah, I totally agree with Mark, the comment about respect and learning people's names. I frankly, I think one of the things we're going to do for the APDR diversity committee is to come up with a PD checklist of things that we do. Frankly, one of the first things that sorry, I kind of got distracted from this whole conversation, but one of the things I used to do with the residents is that, you know, just talk to them about their race and ethnic background. And people say, no, isn't that illegal? It's only illegal in the job interview phase. But once they're on board, I think it's part of getting to know them. And you know, and for example, what holidays are important to you, and we can make sure we respect your holidays. Do you need is there a place to pray? Where do you pray? And just, you know, just to make it an inclusive environment. So, I mean, there's a whole social media thread about, you know, where do you pray? And people you know, they have to kind of find a closet or, you know, some crazy things. We should just make it easier for our diverse trainees to, you know.
Yeah. Nolan, I think that's a really good point. We have never done that. And I think I really appreciate your comment about maybe taking an insight, have everybody fill out a card, like which holidays are most important to you. I think it's something that Tina brought up that I never, ever would have thought of, right? So I think with all the different religions and the different backgrounds, I think we traditionally were an all-white male residency. And so those holidays and those days of importance were known. So I think that's a great, something to it gives me pause on ways to lead better would be maybe have something like that, ask our residents what things are important to you and how can we help you with that.
Right. Just one more thing, since you got me going. Sure. So I actually, when I was a program director, the in-service, ACR in-service was 1 day, right? Now it's different days, but it was 1 day. And it happened to be Lunar New Year. And so but it was a program where, you know, we were really you couldn't take vacation, you had to go take the in-service. And so one resident said, you know, it's Lunar New Year. I always go to my family on Lunar New Year. I said, go to Lunar New Year. The hell with ACR. I mean, that was very not right of the ACR to schedule an exam. Would they have done that? You know, would they have done it on Christmas? I don't think so. Would they have done it on, you know, in other important holidays? No, but they kind of just like thumbed their nose at the segment, which is a pretty sizable segment of radiology, that, you know, it's an important holiday.
So I think what is important is that knowing that the discussion of diversity and trying to really make it a part of our lives has just started. And it's not about 1 or 2 sessions a year, but diversity is something that we need to talk about and be aware about all the time, because microaggressions can come up every day. There's a really great video, actually, Dr. Mullins. I went to an Emory Zoom conference about microaggressions a while ago. And if you Google mosquitoes and microaggressions, there's a really short video that really sort of makes you understand why microaggressions are so, can be so damaging. You know, and if you are a person like, I am able-bodied and I am heterosexual, so those are things that I don't think about at all on an everyday at all, because I'm part of that dominant group. But if you're not part of the dominant groups, those are things that you think about. And so, you know, if you say something that is going to be, that you don't find offensive because you're part of that dominant group, that doesn't, you know, you need to get out of that sort of self and think about how it could be impacting somebody else. So I think diversity is really something that needs to be interwoven in our everyday lives.
Yeah.
Good.
Miriam, I was going to share with you some practical tips for more women in URMs. First thing to do is just put it on your website that it's a priority, that you value diversity. So the first touch point for every medical student is your website. And many of the women and underrepresented minorities that came through commented that there were very few websites that promoted that as a central core value of their residency. So I wouldn't put it on there unless it's true, right? I mean, if that rings true for you, and if that's something that you're trying to achieve and you have buy-in from your faculty and your evaluation committee, then I would start there. Next, I gave a lecture on this. My first year as a program director, as a woman, my first match class was all men. And it was because I did not interview enough women. So I didn't realize that when I first started, it's still low. It's in the 20% range. So our goal is we have a residency of about 13 and is to at least get 5 or 6 women. So that means we have to interview a lot. So go over your numbers. And since they're being recruited everywhere, you have to interview more than you think. So that's another, I'm just trying to give practical tips. And then for underrepresented minorities, we partnered with our university, who has a club and a committee, and we joined with them so that when the underrepresented minorities came, they met with other candidates that were applying to surgery and orthopedics and other, so that there was a community, so they could see the community. We also had started a rotation during the summer in which we give scholarship to those who are underrepresented or who have low income and couldn't afford to come on campus. And we provided them flight as well as lodging. And that was a very successful pipeline. We've been able to recruit 1 or 2 per year from that. So those are just practical tips.
That's great. Thank you. Mark Mullins has a question, comment. I'm going to unmute him, I think.
Yeah. Can you guys hear me?
Yes.
The short version is I just wanted to echo what was being talked about earlier. You got to not only talk the talk, but walk the walk. And I think that goes a long way. People know if you're being authentic. So in the moment of applications, like Angelisa was saying with the website, you want to be authentic. You want them to be authentic, the applicants. You want to be authentic yourself, right? So putting forth the website, but also I feel like marketing without substance is evil. But if you have substance and you don't market, it's a lost opportunity. So if you're doing great things along these lines, let people know about it. And then people will pick up on that. And then as you go about your daily life, your days, your weeks, your months, your years, show people it's important. And in all of our locations, it's going to be top down as well, right? People look to the leaders, not only you guys, but everybody above us, you know, in the org chart, right? So so one of the things you can do is have a diversity committee in your department, which has, you know, activities and authority and does something and gets stuff accomplished. And then, you know, in addition to liaisoning with your medical school and your local GME and all those other things as well, like people have been talking about. But if there are things you're doing,
Right.
then you should be showing those off and letting people know about it. And if you want to grow it, that's a great idea. If you're not doing anything, you need to start ASAP, and get those things going. If you can't get it on the departmental level, start on the program level, and then grassroots it, grow it up from there, show people what can be done. And, there's stuff to do, but walk the walk and talk the talk both.
Right, and there's got to be, try to reach out to other programs or other in your own institution, and don't work in silos, and get, best practices from other people. I've also included in the chat under the answered box a paper that was written by a group of people, including Carolyn D. Benedictus, who does a lot of work in diversity in our societies, about how to strategies for recruiting for gender equality.
So that's good, Ernie. I think we're done.
Yeah, I think we're done. Thank you, everybody, for
Great.
joining. Thank you, Angelisa and Ann, for taking the time and kind of leading the discussion. It was very insightful, and I believe we all learned a lot today, and I really appreciate it. So thank you.
Before we go, Ernie, do you want to
Yeah.
ask them to have any suggestions for future meetings, to write in any topics?
Yeah, that'd be great. I'm wondering
There's
if
14 people still on the line. If anybody can write in under Q&A what they feel is a topic that, as a new program director, they would really appreciate. I think we would appreciate knowing.
that would be fantastic. Yeah, thank you. And then
Can I just put a plug in for recruitment, since today is opening day?
Yeah.
This is a new world, and there are obviously some, we're building the cars, we're driving it. So there's a lot of changes this year, and so it would be great to have that as sort of a standing piece this year, and then look back next year. I would say this is going to go on for some time. Like, I predict people will probably look at virtual interviews from this year and say, if it at all goes reasonably, people will probably say, let's do it again next year, right? Even if we don't.
I agree. Just on the expense alone.
Yes.
Yeah.
Yep, absolutely.
So things like that. So if we could have that as a standing line item, I would strongly suggest that. I think, like every time we get together, we probably will grow in our experience, each time, and know a little bit more each time. So just a suggestion.
Yeah. Sounds good. It sounds like recruitment, Ernie, is what is what I see. All right. Thanks, you guys.
Thank you.
Thank you so much.
Great job. Thank you. Bye.
Thanks, Mark.